UDS 2021 Clinical Quality Measures. Today we will be covering Table 6B11, Cervical Cancer Screening. Cervical Cancer Screening Measure Description. The percentage of women 23 to 64 years of age at the beginning of the reporting period who were screened for cervical cancer. That includes women 23 to 64 years old if they have had a Pap test less than 3 years prior to the end of the reporting period, or women 30 years old or older if they have had an HPV test less than 5 years prior to the end of the reporting period. This measure can be captured a couple of different ways. The first way is through lab results. Within the attached results or order, check the appropriate lab results linked to the order. Mark it as reviewed. This workflow will close the lab task and order event and make the patient compliant for this measure. The second way to capture this measure is by using encounter findings. In the Quality Measures form, select the Screening tab, then the Cancer tab, and then enter the full date using the two-digit month, two-digit day, and four-digit year of the last Pap smear or HPV completed. Reminder, whenever documenting an encounter finding of this type, it is highly recommended to have a scanned image of the results somewhere in the chart. Documenting these encounter findings will make the patient compliant. Cervical cancer does have some denominator exclusions. They are if the patient has had a hysterectomy procedure, if they have a diagnosis that indicates an absence of a cervix, or if they've received hospice care. Where to document the denominator exclusion? In the Quality Measures form, select the Screening tab, then the Cancer tab, and enter the full date of the total abdominal hysterectomy or the date of the vaginal hysterectomy. This documentation will exclude the patient from the denominator. If you have any questions regarding this clinical quality measure or any other UDS question, please feel free to email HCN UDS support team at hcnetwork.org. Thank you.